Namaskara. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a renowned psychoanalysis and psychiatrist, Dr. Lakshmi S. S means smiling. And she's not only smiling herself, she makes her patients also smile. And she is a gold medalist not only in the diploma and also in the MD psychiatry that she has done. And she has done the postdoctorate in women mental health. And she is also expert in autism. She has done lots of research work in that in St. John's Hospital. And now she has her own uh, place where she's treating the patient. And that is called as Ahasare. Ahasare to the neuropsychiatric patients. And today she's going to talk about the premenstrual syndrome. So please tell us what it is.
Yeah, so this premenstrual syndrome is a term that we use. It's a very broad term, ma'am. I mean, many women can have premenstrual syndromes in varying degrees. So we can say that, totally, if you want to include it, it is the changes in the mind and changes in the body that happen just prior to your menstrual cycle. So,
Okay.
say, suppose the menstrual cycle is about to start today, it can start from few days before. It can be
Yeah.
3 to 5 days before, it can be a week before, but a woman experiences lot of psychological changes and physical changes during this period. So that is what we call as premenstrual syndrome.
What are the psychological changes? What exactly happens, and what is how her behavior changes just before the menstrual period?
Yeah. So the changes may include from, getting angry very easily, getting
Okay.
irritable very easily,
Okay.
or, crying for
Well,
small
that's
things.
why whenever I go to any teachers or any colleges, when I ask who all get angry, women raise their hands much earlier. I used to think the men are always angry, and the women also why they're angry. I used to think probably this is one of the causes. Okay.
Yeah. So it can include mood changes, becoming
Hmm,
anxious, sleep not
hmm,
being good, not feeling
hmm,
hungry.
hmm,
So a lot of these changes can happen during those days, along with
hmm,
some physical discomfort also. There can be a lot of fatigue,
hmm,
body ache, that
hmm,
bloating sensation in the stomach.
hmm.
So altogether is what we call as premenstrual syndrome.
Okay, okay. Does everyone get this, or only few percent of them they get? How many? What is the incidence of this premenstrual syndrome?
Yeah. The premenstrual symptoms or syndrome can happen in a lot of women. Almost 70
Okay,
80% of the women may experience some or the other things. I'm not saying
in
everybody
a very
experiences
mild
the
form.
same way.
Okay.
Yeah, there may be people who have just a little bit of fatigue. There may be people who have, just sleep disturbance like that. But the severity can vary.
Hmm.
About 5% of women actually
Hmm.
experience it in a very, very severe form. And that's what we
Okay,
call
okay.
as
Hmm.
PMDD, that is
Hmm.
premenstrual dysphoric disorder. Now we are giving the
Oh,
term
dysphoric
disorder.
disorder. That means it is a disease and not just
Yes,
a change in the moods. Okay, okay,
right, right. So this severity is there in about 5% of the women,
okay.
where the symptoms are so severe that it causes dysfunction in their daily living, meaning they are
Hmm.
unable to do their work properly, they're unable to handle relationships properly. Whatever they were trying to, do in the rest of their, monthly days, in this
Ah,
period, it causes severe disruption. So
yeah.
that is when we call it as PMDD.
So,
Yeah.
but that may cause stress to her as well as the family members also, no? Because if her moods are swinging and then if she's irritable and shouting and yelling at the children also will feel bad, mother-in-law will feel bad, husband also will feel bad, and they may mistake her, though it is not her fault, it is not in her hands. It may cause a real difficulty in the relationships also, I suppose. And
Yes,
it
yes,
should all,
definitely.
yeah, it should all of them come to you. How do you investigate and how do you make the diagnosis?
Yeah, the diagnosis is mostly clinical because
Okay,
investigations don't help much since it is
okay,
more related to the sensitivity of the body to the hormonal changes. Hormonal changes
okay.
happen in every woman, but
Yeah,
how sensitively my body and mind are perceiving that change is what
okay,
matters. So
okay,
we don't
okay.
do much of investigations.
Hmm.
But like you said, yes, it's very right. Others should also understand. Otherwise,
Yeah,
they feel like, okay, this person was a
I
different
know.
person the first 20 days
Yeah.
of the month. And then suddenly, she changes so
Okay.
much. Yeah.
Okay.
Yeah.
A
But
very
but it's all
loving,
due to the
caring,
hormonal
smiling
change.
person, suddenly becomes angry and red and, scolding everyone. So that's a sudden change. Okay.
Yeah.
Okay. So how do you treat? Do you treat with the hormones or drugs are there or what is there?
Yeah. So again, the treatment depends on the severity of the problem. If it is
Mm,
just premenstrual symptoms or premenstrual syndrome, like I said,
mm,
which many
mm,
women can have, then
mm,
just lifestyle changes may help.
mm,
Bringing that awareness into you that, that, okay, this part of the cycle, I'm not at my best. I'm not
mm,
able to give my 100%. So
mm.
schedule your work accordingly. Don't put,
Okay.
all the stressful events on that week of the
Yeah.
month.
And then it's going to be worse. It is like
Yeah.
adding ghee to the fire, and that will be
Yeah.
still worse, because as it is, their mood is not all right. And on top of that, the stress also comes up. Then it will be very difficult to handle. Okay.
Yeah. So trying to keep, some balance in work, etc. during that period. Also, if
Okay.
there are very close family members, to sort of make
Mm,
them also aware that, you might
mm.
not be reacting the best way during those
Okay.
days.
Okay.
And
Okay.
if they can be a little compassionate, not carry on with the fight or, arguments, etc. Then after 2 days, the woman herself may realize that she overreacted.
What? Yeah. It is like taking the anticipatory bail. The anticipating that she is going to cause some, hurting the others. So tell in advance. So I'm going to have this mood changes. So please don't mistake me. And that
Yeah.
is good. In
Yeah.
fact, we
Yeah.
had a colleague. Whenever he used to be furious and upset with somebody, but on the face he would not fight and scold them. He would wait for the party, and during the party he will have a peg, and then as soon as he starts drinking, he'll start scolding and blaming and everything, and he used to take away all his anger out. So people should not mistake like that. So better to
Yeah.
understand that a woman during the menstruation or before menstruation, she is not a normal person because of the hormonal changes. So I think the family members also should understand, and they should have empathy for her rather than the
Yeah.
sympathy. And
Yeah.
you
Yeah.
said the lifestyle
Definitely.
changes. What lifestyle changes she has to make?
Paying attention to diet, exercise,
Hmm.
even
Hmm.
yoga. There are some
Hmm.
specific asanas which are directed towards the reproductive system in the woman.
Hmm.
Those
Hmm.
also really help. So they can get
Hmm.
into such practices. Being
Hmm.
mindful if they also have thyroid or PCOS and other related disorders will
Hmm.
also help. So
Hmm.
this will suffice for mild to moderate problems. But if it is very severe, like I said,
Hmm.
if it is going to PMDD stages, then
Hmm.
we do give medications called SSRIs. They
Okay.
belong to a group of antidepressants, but they do help a
Okay.
lot in PMDD. So
Okay.
that medicine is given. It
Now,
can
how long, what dose and how long do you give? What is the duration? Like antibiotics, you give for 5 days, 7 days, 10 days, but this is for how many days they have to take the tablet?
for some people, it is so severe that it starts off 10, 15 days before their menstrual
Oh
cycle.
my
So,
God.
in
Oh my
such
God.
people, we do give them regularly only. There may be
Oh,
some category of people who will benefit only by taking that last 1 week of their
okay.
menstrual
Okay.
cycle.
Huh.
Yeah, yeah.
Okay.
But it depends. But it's known to help a lot of women in
Hmm.
regulation of these emotional changes.
No, but it is so sad, a lady who's so smiling and so charming and so gracious and beautiful. And during those periods, she becomes like, very furious and angry and agitated, the angry young woman. I think
Yeah,
people have to understand their difficulty also, and they also have to adapt. I think by doing meditation to some extent, they can get the endorphins, neuropeptides, the feel good hormones, which can bring down the this depression or the anger or agitation, and all those things can come down. So I think
yeah,
they
yeah.
they have to try not only the drugs. Along with the drugs, non-drug therapy also can be tried, I suppose. And now these patients, will it continue till they get the menopause, or after delivery it comes down, or how is it?
Yeah. It depends on person to person. Not everybody gets relief soon after childbirth also. Some people think so,
Okay.
but it doesn't really come down.
Hmm.
For some people, it may be very severe in their 20s and early 30s. That's when they would need treatment. Slowly, it sort of gets better over a
Hmm.
period of time. Also, I think people understand her better, so they also behave,
Hmm.
well with the woman, understanding that okay, she's not going all right during those days. But it depends, ma'am.
Hmm.
There are teenage girls also who experience
Hmm.
this a lot in their
Okay.
younger
Oh,
days.
okay.
Mm,
Okay.
yeah.
I think it will come in the way of their studies if they are teenagers,
Yes.
and
Yes.
in their work if they are working women, and even if they are at home, if half of their life they have to spend, then it is like, a full moon day and no moon day. 15 days full moon day they are very happy, and 15 days no moon day they are always grumpy, drowsy, and yelling at everyone. And I think
Yeah.
it is difficult, so to get something, you have to lose something. To become a mother and to get the OM, and they have to get this hormonal changes. Is it related to the OM, I mean, excretion, or not related to that?
No, some people have that problem, a little bit of physical pain during ovulation and all, right? That is
Okay,
different. This is more
okay,
of that luteal phase, ma'am. Post
okay,
ovulation, the luteal phase start, right? So that
okay,
is when
okay,
they start having mood changes. For some people, it's only 2 3 days, whereas
okay.
rarely, for some people, it's so severe that, like I said, it's half the month. And which workplace will understand that you are inefficient
No, the
for 1 week in
work
a
people
month?
also will not understand, and the family members also will not understand, and only a psychiatrist like you can understand. And then, and I think the best thing is to change their lifestyle. And then
Lifestyle.
you said the food. What type of foods will bring down the depression, like banana and other things, or
We don't say specific foods. We try to say, keep it as healthy as possible, because junk and oil and all
yeah,
that is
yeah, I know, I
good.
know, I know.
Sugar, high
Junk,
sugar will,
junk food. Yeah, correct, correct. Especially the high sugar will increase the stomach upset, and then nausea and sickness and weakness. And especially the chocolates and cakes can be causing more nausea. And I think
yeah,
that is
yeah.
right,
And
eating
it will
fresh
lead to a lot
fruits.
of
Yeah, yeah.
erratic pattern. Like they'll overeat during this 1 week,
Hmm.
take a lot of sugar and all that. Then they feel guilty, and then they
Hmm.
starve the next 2 3 weeks. So it's like,
Okay,
your
okay.
diet is never balanced and
I know. So
nutrition.
better to be disciplined in your diet as well as the sleep, and doing the yoga and meditation, which can be a non-drug therapy also. So consult the psychiatrist, take the drugs given, and along with that, you can also do the non-drug therapy like yoga and dhyana. So finally, if you want to conclude, what are the tips that you want to give it to such women?
Yeah. I mean, I want to tell the men around those women that this is not
That's
drama.
a good one.
Yeah,
Good.
yeah. Because they think that, they use this excuse for everything. They do drama and all that, which is not really the case. I mean, there's so much of internal chaos going on in women during this period. So please be sympathetic towards them, and do help
Be
them and support
empathetic
them.
rather than sympathetic. Yeah.
Yeah.
Yeah. Okay. Then
Yeah, yeah.
what else?
And for women, it can be like, see, it's not unmanageable. Yes, I do understand for some people, maybe it is very severe, but for
Hmm.
majority of the people, it's not that disabling also. So
Hmm.
being mindful of it, understanding it, reading about it, and one
Hmm.
thing may work for somebody, well. For
Hmm.
one person, yoga may work very well. For some other
Yeah.
person, diet may help very well. For some other
And the
person,
music,
meditation
some
works.
music, and keeping themselves with the other things also is very important. So
Yeah.
thank you very much, Lakshmi. It was so nice talking to you, and you are so empathetic to women. And I think, this is the learning point for the whole family members, that they should be concerned and this thing. And probably that is the reason in the past, they used to keep them away, not give them any work, and give them complete rest, so 5 days, and
Yeah.
probably that was the thing, Okay, thank you so
But
much,
at least
Lakshmi.
during menstruation, people
Yeah,
understand. This is
yeah.
premenstrual, no, ma'am. So
Premenstrual, yeah, 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 yeah. Okay, thank you so much, Lakshmi. Thank you.
thank you. Thank you. Thank you.